So interview must have a background also. So you'll just tell me your internship experiences.
So during the last 3 years of studying psychology, I got the chance to work at some organization. And some of the internships that I did was social work research internship at Child Rights in which stands for CRI. And I worked as a social worker and also as a research intern. Another internship was as a clinical psychology intern at Munchen Hospital. At that place, I learned under some prominent clinical psychologists and psychiatrists, and I got to learn about case history, mental status examination, and diagnostic testing and assessment.
So
Uh,
you will give me the detail of these three. So you told me you learn about the case history. Next, what?
Mental status examination (MSE),
Mental status examination and the diagnostic. What is
assessment and testing.
assessment? So can you explain all these three? How you do it, or why people, how doctors do it?
Okay, so the process is like as soon as your client comes, the first thing that you do usually is taking the case history. The case history consists of your identification data, your occupational history, your marital history, your even your behavioral observation. Because right from that moment the client enters your presence, you have to observe him or her, and also your prenatal history, your postnatal history, your presenting complaints, what present complaints are you facing that you have to elaborate on them. And then you basically case history taking is a rapport formation stage. You try to form rapport with the patient, and at the same time you fill on the all the necessary information. So this is more of a fundamental for which creates the further diagnosis that we have to build. And then comes the mental status examination. It has a lot of it has a lot of elements, like it deals with psychological components, cognitive components, emotional components, and that at some components I remembered, like uh, body posture, how the client is behaving, what is this stupor. Stupor means the posture. It is very rigid or it is very flexible. How is the client speaking, and all these things, basically behavioral and emotional aspect. And then comes the diagnostic testing and assessment phase. That phase usually comes before the psychotherapy or after the psychotherapy. It is interchangeable. So in diagnostic testing and assessment, basically what we do, we administer different tests. These can be personality uh, test about neuropsychological testing, and all these tests are administered. Now I make a distinction between assessment and test. Assessment is a broader concept. Within it, there are different approaches like behavioral observation, clinical interview, and testing. Now, testing is one of the component within assessment. So assessment is a broader concept, and test measures only one characteristic. Like personality test will measure my personality. Like a test would be like new PI or MMPI, which is Minnesota Multifaceted Personality Inventory. So these are some tests we use in clinical psychology and counseling psychology.
Okay. So this is the step of uh, that you learned there. Next, what was just continue with your explanation or experiences with the internship.
With the same internship, or do I have to?
Next one.
Okay. So my next internship was at work, which is Women Empowerment Research Project. There I was part of a 1 month internship. I was working on a working paper on socio-eco-psychological impact, looking at socio-economical psychological factors that impact women's education in India. Also, uh, I also volunteered at multiple places. Like I was a conference volunteer with with an organization, and also I got to chance to also do some trainings and workshop with different organizations, as I did a VORAM, which was a research workshop, and mental health allyship, which was another workshop that I did with SOSAS, which is a mental health initiative, and it is basically sensitization training for mental health professional and normal individuals alike. That
Okay.
was some of my
So
experience.
Nikhil, tell me about your future goals.
So in terms of my future orientation, as far as my academic orientation is concerned, I'm more inclined towards psychodynamic and music therapy. And although I like both the fields as far as the academic and practitioner side of psychology is concerned, but uh, what but that is one thing that really I have to look at is like in terms of my academia where I have to go, like in terms of getting the future degree which can be PsyD, MPhil or a PhD. So that is one thing. And second, when it comes to my another short term goal is to opening my listening project in my local community. And one of my another goal that is related to psychology is to open a social enterprise, uh, which is primarily based on rural mental health interventions and programs, and follows a bottoms up approach when it comes to mental health. So that are some
So
of my
you
goals.
so you'll be trying to will you try to open a social enterprise or an NGO which basically helps people in getting better mental health or
So actually, that is one of the things that I'm really thinking about, because uh, both the models are very similar, but they are very different. But currently my mindset is more leaning towards the social enterprise side of it, because the amount of people that have built their organization within that structure is very large. A lot of people have employed the social enterprise structure to build their own organizations. I'm not saying that an NGO might not work for my ideas, for my expertise, but uh, I really have to further look into to also be more open to this other side of it. But as of now, I'm inclined towards the social enterprise side of it.
okay. So I would like to know, you have done your graduation or you are doing your graduation from Ambedkar University, Delhi.
Yes, sir.
Huh? So what is the uh, qualitative or how you'll critique and what I can say, how you assess your graduation program in your university in terms of psychology studies?
Okay, so before I answer that question, I really have to situate myself where I'm coming from. Where was I coming from before joining the graduation program at this? Oh, sorry, Ambedkar University. So basically, by till my graduation, I have never studied psychology. So it was my first interaction with psychology at the graduation level. And at Ambedkar, first of all, I would say from a critical standpoint, the course is very individualistic, I would say. The amount of the capacity for personal growth, personal development, and personal insight is through the roof, I would say, at Ambedkar, because even the assignments, the way professor teaches you and the discussions happen at class, it is very individualistic. Like, there were some assignments where I have to write about my own personal experience from my childhood. They were uh, courses which were entirely structured about my childhood, and there were also courses where I have to explore my own personality. So a critique of it would be, once you come out of that environment, you really realize that the the outer world, the outer reality is very different from the bubble that the professors and the administration have created inside Ambedkar University. So that is one of the biggest criticism that I personally have about my university, that uh, although you will grow personally very immensely, but once you go out of the environment, much of the way our education system is structured is very objective. You have to really shed out that shell of individualism. So that is one very critical thing about Ambedkar. But overall, the structure of the courses they teach is somewhat similar to most institutions of psychology around the country. So that is something that we really need to look at a bit, to include more objectivity in terms of
Okay, so
study.
in recent times when pandemic was there and lot many things happening to the society, like people were falling ill, people were dying, and a lot many
Mhm.
people were suffering from job loss, and they were becoming poor by either by not earning or by spending lots of money on health structure and everything. So we also are suffering and we are having big risk of mental health. and lot many families and people, and the result of which we have started seeing through newspaper, like lot many not matlab, many crime or events are happening which can be contributed to the bad mental health. So as a university you have just passed, and as a university, Ambedkar University or Delhi University or any university which basically provides good education for psychology, so people were criticizing that university has failed in responding to the situation, or being participated in the solution, and being the solution for these problems. So do you think that your university or you or your fraternity could have done better in uh, coming out and finding different way to intervene in this kind of situation, or like us, like many other people, like all the other people, you people are also looking for the government's signal to come forward and have a policy based interventions only. So do you know any attempt from any university to
Yes,
intervene in this kind of thing?
I can elaborate on it. So my own university has a clinic which is called EHSAS, and EHSAS clinic is offering free psychosocial support for all students and individuals alike, and they are doing it from the mid of 2020. And because a lot of my professors were from that clinic, sir, the whole notion of us not doing the job, I don't really, I don't really comply to that, because some of my professors have lost their relatives. They were still working. They have to go through the grief and the mourning of losing their own relatives the second COVID, and so they were treating patients, they were treating clients. So overall concept of us not going out there, first of all, we should look at where this criticism is coming from, because neither do we have the workforce to cater to this mass population that we have in India. WHO probably said in 2019 that by 2020, 20% of the population of India will be suffering from mental disorders and illnesses, and we have only 0.07% psychologists to serve every 1 lakh population. So even if all of us are out there, which most of us were, sir, we cannot solve the mass of the problem, because neither do we have colleges, neither do we have the infrastructure to do that. And although this is the valid criticism that we should be out there, but at an institution level, most universities have either given free psychosocial support or have opened their own helpline, or they are giving at least their students a support system, because psychological fraternity believes in empathy, believes in giving warm support to not only their students but also the individual.
Okay, so matlab, in your point of view, people from psychology or the university or any matlab, people who can help is in very less number. So whatsoever they are doing is not being noticed because of.
Absolutely.
Okay. So let's accept the situation that people in psychology and people in this particular profession are very less in numbers. So can we have something, some kind of training that you can give to other people who can basically intervene in the similar situation? So if I'll say, can you create a module or can you create a training program to, to teach someone who is not from psychology, but you can just assess their quality or their natural capability to be is someone who can be the part of the help. So can you say or can you suggest, if it is possible, just elaborate to me how it is possible. So can we have a 6 month or 1 month, sorry, 6 month or 1 year course that can be given to any other graduates and who basically can help other people in that way, and a very mild and proactive way to deal with this kind of grief and mental health problems.
So actually, I do have a solution, because proactively I was also thinking about the same issue as to how to cater this. So that's why I'm starting my own listening project, because listening is one area that even a psychology graduate can really do that, because there's no ethical or professional boundary to that. For counseling, we require at least you have to be passing your master's degree, and for a clinical psychologist, the minimum is either a diploma from RCI or an MPhil from a RCI accredited college. So what we can as a fraternity do is start doing community projects in our own locality. Listening projects can be started by students. Like I'm personally thinking of doing that. By that we can cover a big area, because our one of the good things about India is, even though we are so segmented by different factors, socio-economically, culturally, but we still live in a community way, in a collective way. So we need to sort of utilize that aspect of our community, and do listening projects, which can really help people in opening up at least, and then they can proceed to a much more deeper intervention like counseling or clinical psychology.
Okay, so nicely said. So the last question for you will be, you have applied for mental health also, and this is your first choice,
Yes, sir.
psychology. So why didn't you apply for any other subject, like matlab if you get rejected for all these two courses, so what other option do you have for yourself?
So in terms of that, I would say this obviously has a has very good courses, but for me, I'm at a stage where I need to study psychology at an MA level to really be not just be it will not just be the starting point for me to be eligible for the professional part of it, but also to be able to go further from that. So considering that, so that is one of the reasons I didn't apply to other programs uh, beyond the mental health and the psychology space. And beyond that, if I don't get selected to this, then my two other options will be obviously my previous college, Ambedkar University, Delhi, and Jamia. And if I don't get into these colleges also, then I would opt for a fourth year at my university. Then I will again prepare for TISS for the same programs.
So you
And
do have option of fourth year.
yes, sir, in Ambedkar University, we have option to opt for a fourth year.
Okay, so can you also tell me how beneficial is that?
So because see, when you are opting for a fourth year, it is not very rigid. There's no attendance, 0% attendance. At the same time, the assessment is somewhat very flexible too. So you can really do that, and you also can do some courses that you weren't able to do in your first, second, third year. And at the same time, uh, obviously, sir, I've spent 3 years there, so that experience will become very useful. And within that, I can do internships, or I can do part-time jobs, or workshops, or something related to the job space too.
Okay, chalo, Nikhil, thank you very much.
Thank you, sir.
So the point is कि हमने introduction part और बहुत सारा part ignore किया क्योंकि I know about that, दो तीन बार interview
Mhm.
ले रखा हूँ, but the question that I asked today or the answer that you gave was very good, है ना? इसमें कहीं पे भी flaw निकालना मुश्किल था मेरे लिए, है ना? हो सकता है कभी कभी क्या होता है कि जैसे अभी हमारे पास एक वो आया स्टूडेंट का कि उसने बहुत कुछ पढ़ा था, एंड द टीचर
Mhm.
आस्क्ड एवरीथिंग ही डिड नॉट स्टडी, तो बिल्कुल ही अलग। तो थोड़ा बहुत ऐसा केस हो सकता है, अदरवाइज योर अलाइनमेंट इज गुड, योर थॉट प्रोसेस गुड, एंड आई जस्ट रिमेम्बर्ड the first time you came to, or you come to the meeting and you said that you will also be breaking that taboo that female graduates are more
Mhm.
वो इंटरेस्टेड इन साइकोलॉजी देन, है ना? तो
Mhm.
अच्छा होता है कि ये सब बात तुम नहीं करते हो, इट वाज गुड, है ना? सो
हाँ,
योर
तो वो
गोल
गलत
वाज,
था वैसे तो।
हाँ, तो पता नहीं वो
आई पुट
कैसे
इट द
तुमने,
रॉन्ग वे।
हाँ,
आई पुट इट द रॉन्ग वे।
चलो ठीक है, मतलब इट वाज गुड इंटरव्यू। कब है तुम्हारा?
तो मेरा नाइन्थ को है। सर एक चीज पूछनी थी। वो जो
हम्म।
सर आपने जो क्वेश्चन दिया था वैसे काफी अच्छा था कि कि हम लोग बाहर क्यों नहीं आ पा रहे, सर उसका थोड़ा डिफेंसिव आंसर तो नहीं दिया ना मैंने कि आई बिकेम टू डिफेंसिव फॉर माय फील्ड।
नहीं नहीं, वो ठीक था, मतलब हाँ, लेकिन थोड़ा सा तुम इसको क्रिटिसाइज तुम भी कर सकते थे कि योर यूनिवर्सिटी डिड, बट मेनी यूनिवर्सिटी डिड नॉट। तो थोड़ा जैसे मतलब स्मॉल एफर्ट भी काउंट हो सकता था। तो बहुत स्मॉल एफर्ट था, इनसिग्निफिकेंट था, तभी हमने काउंट नहीं किया कि हाँ थोड़ा डिफेंसिव था, मतलब आई डिड नोटिस दैट एट दैट टाइम, बट आई ऑल्सो कंसिडर द सिचुएशन कि हाँ भाई इतना कम है, और वो कल्चर भी तो हमारे
हम्म,
यहाँ नहीं है ना। इवन
हम्म,
इवन गवर्नमेंट और सोसाइटी डू नॉट एक्सपेक्ट
हम्म,
यूनिवर्सिटीज टू कम आउट। बट मुझे लगता है कि नॉट ओनली साइकोलॉजी, बट मुझे लगता है कि इन मेनी अदर फील्ड जो यूनिवर्सिटी है दे शुड कम either with advocacy or
हम्म,
with policy types or similar research, है ना, which they can push to the मतलब government by getting approval from the public also. बट ऐसा क्या होता है कि जब भी हम लोग ऐसे टाइम में देखते हैं, तो जब यूनिवर्सिटी स्टार्ट करती है तो दे आर टेकिंग लॉट में मतलब मेनी सेमिनार वो करती है, वेब सेमिनार वेबिनार कंडक्ट करती है, एंड दे आर नॉट डूइंग एक्चुअली व्हाट दे कैन डू other than conducting web seminars or web based debates. तो ठीक है, ऐसा कोई दिक्कत नहीं है उसमें, डिफेंसिव हो भी गया तो कुछ और पूछोगे?